Hello friends, this is Dr. Aishvarya Kaushik, your original guru for conservative dentistry, endodontics and dental materials. This video pertains to the recently concluded, rather, an examination that most of you appeared for. That's the Rajasthan Medical Officer Examination 2024 for dental surgeons. This video pertains to the discussion of conservative dentistry and endodontics, guys. The first question, which is used as a pulp capping agent, very simple, direct question. The traditional pulp capping agent is calcium hydroxide, and the modern ones are the bioceramics or the calcium silicate based cement. So you'll have MTA, biodentine, endosequence, etc., etc. Right, guys? Now, here the answer is biodentine, no doubt, right? Probably some of you got confused with MTAD. That's basically an irrigating solution. That's a mixture of tetracycline acid and doxycycline, right? So biodentine, no doubt, is the answer here. Second question, which of the following is a metallic rubber dam frame? Now, classical rubber dam frame, normal, U-shaped frame, which has got certain evaginations like this to engage with the rubber dam, sheet. That's the classical Young's frame, right? You also have, for an image-based question, so that's a classical metal frame, right? So the answer is Young's frame. Just for your added knowledge, you also have a very common question with the Nygaard Ostby frame. Nygaard Ostby is like this. It's like a a kind of a closed ringed kind of a device, which is basically a plastic frame, right? That's a plastic frame. It also has these evaginations, these extensions to engage with the rubber dam sheet. So anyways, here the answer no doubt is the Young's frame. That's the answer. It's a classic, old time, old school frame. Now this is a controversial question, guys. REDTA. Now what is REDTA? It's basically a combination of 17% EDTA, right, with another chemical, which is nothing but cetyl trimethyl ammonium bromide, right? Cetyl, R stands for basically cetyl trimethyl ammonium bromide, right? And my dear friends, just one more important point here, that this is a component of a topical anesthetic, that is cetrimide, right? All right, that is cetrimide. So the answer here is EDTA plus cetrimide, right? So it's an applied question. Now, why am I saying it's a controversial question, guys? Because cetavlon, if you actually had, ideally, if I were the examiner, I would not put cetavlon as one of the options. But there was an option of cetavlon according to some references here. Now, cetavlon also contains cetrimide, so that makes this, answer slightly tricky. But ideally, the answer would be, in all likelihood, EDTA with cetrimide. This remains a controversial question. If this is asked again, I would go with EDTA plus cetrimide, guys. Most commonly, the middle mesial canal. A middle mesial canal is found in up to 15% cases in the mesial canal of the lower molars, lower first molar. So mandibular first molar is the answer, guys, right? The cavity varnish applied to decrease post-operative sensitivity in amalgam restorations. How does it work? Now, guys, one is it decreases micro leakage. So the answer is D. It minimizes micro leakage, marginal leakage around the restoration. That's one. Of course, it also helps in prevention of the option A, prevention of penetration of corrosive products into the dentinal tubules. Guys, but as far as management of or decreasing post-operative sensitivity is concerned, I would go with option D. and that is minimizes the marginal leakage around the restoration. So the answer is D. Method of rapid tooth separation. Now, guys, in rapid tooth separation, we either use the wedge principle or the traction principle, right? Now, here traction is not given, simple wedges is given, so the answer is wedge, right? The answer is wedge, the method of rapid tooth separation. Cracked tooth syndrome, another name. See, ideally, vertical root fracture is not cracked tooth syndrome, but the closest answer, of course, subluxation, intrusion, concussion, these are all, luxation injuries. They've got nothing to do with cracked tooth syndrome. So, of course, the answer is vertical root fracture, although this question is ill framed. It is a cracked tooth syndrome is separate than a vertical root fracture, but in this context, the closest answer is vertical root fracture. So the answer is D. Metal modified GIC, that's your miracle mix powder. It's basically nothing but a admixed GIC, right? So one is admixed, the other is Surmet. Now admix is basically a physical mixture of the GIC powder plus amalgam alloy powder, right? And you don't sinter it. If you sinter it, you get Surmet. Here it's asking about the admixed or the miracle mix or the metal modified GIC. Now in this, almost 70 to 80% is the amalgam alloy powder, and the rest around 20%, 15, 20% is GIC powder. So the ratio is 7:1 actually, right? But here the options are 1:7. So of course there's a misprint here. The answer is B, right? Ideally, the answer when you talk about the ratio of silver alloy upon glass powder is 7:1, right? But probably some typo error. So the answer is 1:7, right? Cutler's method in canal preparation. So basically, Dr. Cutler, what he did was he said that, you can have a good idea of the apical foramen from where the, file is finally exiting the apex, right? And then you reduce, in young patients, you reduce by 0.5 mm. And in older patients, you reduce by 0.67, around 0.66 to 0.67 mm to reach what? To basically reach the apical constriction or the minor diameter. Apical constriction and minor diameter are synonymous, right? So the answer here is, of course, the apical constriction. So answer is D, apical constriction. Photo initiator and dual cure composite. So guys, dual cure composite is basically what? You have components of both chemical cure or self cure as well as light cure. Now, when you talk of photo initiation, you basically are concentrating on how you are supposed to initiate the generation of free radical, right, in the light cure component of the dual cure composite. So what's the activator? Activator is nothing but blue light, right? And what is the initiator? Initiator is camphorquinone and dimethyl aminoethyl methacrylate complex. So guys, the answer here would be camphorquinone, right? Although to be more precise, it's actually a photosensitizer because, camphorquinone free radical, when it is generated, it does not actually get involved in the setting addition polymerization reaction. But yes, in general, you can say, if you don't want to go too much into details, you can say that yes, camphorquinone is a important, you can say, component of the assembly of photoinitiator, right? As far as benzoyl peroxide is concerned, yes, benzoyl peroxide has been used sometimes as a photoinitiator also, but classically it's a component of the self-cure system. It's the initiator of the self-cure system where the activator is a tertiary amine and benzoyl peroxide is the source of free radical, right? So just to revise, activator is the source of energy, initiator is the source of free radical, right, guys? So this was about the discussion of the Rajasthan MO Endo exam, guys. Best wishes to you guys. Those of you who've done well, congratulations to you. But ultimately, guys, our aim is to do MDS, concentrate on the upcoming INI exam and the NEET exam. We're around the corner. We're looking at, we're running into practically August now. It's July end, we're in August. A couple of months, and we'll be looking at the start of winters, stressful times. Guys, don't take any stress. I always say this, stick to your guns. Whatever is the thought process, whatever is your motivation, source of motivation, whatever things that, whatever you think about when you think of your God, your belief system, stick to that. Have faith in yourself, have faith in your hard work, keep working hard, and good things will happen. Right? Thank you guys. Take care.